Hello, my name is Selena Lopez and I am a rising second year student. I've chosen to center my project on Panda Express, and the name of my employee health promotion program is Diabetes Prevention and Management at the Workplace. Nearly all Southern Californians have been exposed to the delicious cuisine trademarked by Spotted Panda. Panda Express is a popular fast food restaurant chain specializing in Chinese American food. On the bottom left is the Panda Express logo, and on the right are a few of the food options offered by the restaurant. While these foods generally contain vegetables, there is no denying that they are high in fat and calories. Fun fact, the Panda Inn logo on the top left was the predecessor of Panda Express by the Panda Restaurant Group, founded by Andrew Chern and Peggy Chern. Panda Express itself was founded by the couple in 1983. They were a Chinese couple that immigrated from China to pursue the American dream. Their hard work and dedication certainly paid off. They currently own and operate 1,571 Panda Express restaurants scattered across the U.S. and Puerto Rico. Their annual revenue in 2012 exceeded 1.7 billion, and they have had an observed growth rate of 5% from 1996 to 2008. Frontline employees cook, prepare, and serve meals, and employees in the company headquarters I contacted for the project work in marketing, accounting, business relations, and restaurant development. For the purposes of this project, I narrowed my target population to frontline employees who represent a higher volume of employees by Panda Express. Panda Express is an American-owned company that has its roots in Pasadena, California. The restaurant now spans the entire U.S., and I will therefore be focusing on the United States health profile. Now, how does the American health insurance system work? First of all, the most frequent chronic diseases include diabetes, heart disease, cancer, stroke, arthritis, and obesity. Prevailing health issues include poor nutrition, tobacco use, excessive alcohol consumption, excessive eating, and inadequate amounts of physical activity. As a nation, we do not boast the best healthcare system or health, for that matter. The U.S. government has the most expensive healthcare system, with approximately $8,000 being spent per person. In fact, the American healthcare system spends 2.5 trillion annually, and that number is actually expected to rise. Sadly, the system's very pricey tag does not mean every citizen is covered by health insurance. Although the U.S. offers quality health care, the price of doctors and medical facilities accounts for 17.3% of the nation's GDP and is more expensive than outside health programs. It is also important to know that a majority of workers in the U.S. obtain their health insurance from employers. Medicare and Medicaid are financed by the government for people who qualify, but the private sector is dominant. Fortunately, the U.S. does have community health centers established by the Health Resources and Services Administration to provide quality healthcare services for underserved and oftentimes uninsured communities. As I mentioned before, healthcare expenses are rising, making workplace health promotion programs ever more urgent. American culture is one that has transcended its borders due to nationalism. Today, it homes approximately 307 million people, making it rank third in world population. American society is multi-ethnic and highly educated, with a high literacy rate. Long working hours and a mentality set on ambition and independence have influenced a highly stressed society. Living in a fast-paced world that encourages speed over quality, fast food restaurants have come to dominate daily life and have contributed to America's increase and obsession with fattening foods. Thus, a huge percentage of the population lead unhealthy lifestyles which value fast food restaurants but have low physical fitness standards. More than 1/3 of the population does not meet physical fitness standards. I contacted the Panda Express headquarters in Rosemead, California. I called the listed number and spoke to Jessica Lee and the benefits team of the Human Resources Department. I introduced myself as a university student seeking to create a workplace health promotion program based on the needs of the company. I wrote a letter and created a list of questions for them to answer and sent them in to be reviewed and answered. Unfortunately, not all of my questions had been answered, but the ones that had provided me greater insight into Panda Express's workplace. Based on both my research and their answers, I decided on creating a diabetes prevention and management program. The importance of public health promotion programs cannot be understressed. Public health programs are vital for the community, state, and national perspective. Of course, health insurance is increasing, and employers will continue to be expected to provide health insurance for employees. Diabetes is a recurring chronic disease reported in Panda Express. Preventing diabetes can potentially save thousands upon thousands of dollars for employers. What it boils down to, however, is that ensuring the health of younger generations is crucial if the U.S. hopes to foster a healthy and capable society. Company benefits can be quite vast. Implementing a workplace health promotion program would certainly boost your company image and improve employee loyalty. It would also help reduce health insurance costs, which, as a reminder, has been growing steadily over the years. A reduction in health inequalities, a decrease in absenteeism and presenteeism, and an increase in productivity and fitness among employees would also occur. The return of investment in the form of saved insurance from the absence and/or reduction of diabetes treatment would also result. As it turns out, the cost of monitoring blood sugar level can range at about $100 per month for a single employee. Employees would also greatly benefit from an improved lifestyle. Increased morale, loyalty, personal and family health, decreased mortality of employees, reduced risk of obesity and unhealthy eating habits, and decreased susceptibility to heart attacks and strokes would all result from successful implementation of a workplace health promotion program. Currently, Panda Express offers a 401k plan and medical, dental, and vision insurance for qualified employees, which is fantastic. They offer Cigna health insurance to employees, and the HR department told me that they currently have 4 employee health promotion programs in place. Stress management, weight management, smoking cessation, and a healthy pregnancy, healthy babies program are offered, although not available to all employees. Unfortunately, Jessica Lee was not able to give me much information to go in depth on these programs. Now, the top reported health issues surrounding Panda Express employees involve hypertension, diabetes, and metabolic disorders. Neoplasm or tumors and musculoskeletal diseases are also growing among employees. Panda Express employees are oftentimes from low socioeconomic backgrounds and are then more susceptible to chronic disease. Another quantity of employees are students, and so they may also be too absorbed in school and work to focus on maintaining health. High stress and poor nutrition oftentimes plague employees, and a lot of them are not physically active. Poor health can also be attributed to the fact that healthy diet foods are generally more expensive than fast food items. I will be focusing on prevention and reduction of diabetes at the workplace. Diabetes is a leading cause of kidney failure, non-accidental amputations, and blindness among adults. 11.8% of men 20 years or older contracted diabetes, as opposed to 10.8% of women over 20 that same year. This shows that men are more likely to get diabetes than women. Also more likely to have diabetes are Hispanics and non-Hispanic blacks. Here are a little statistics on diabetes in the United States. As you can see, diabetes is more likely to infect men over women, Hispanics and blacks, and the uninsured, which generally come from low socioeconomic statuses. For my survey, I decided to split the questions into 4 categories: demographic, lifestyle-related, healthy living-related, and work-specific related. Under demographics, I asked about age, gender, ethnic background, and education levels in order to assess risk levels of the employee population. The last slide demonstrated that certain groups are more likely to develop diabetes, so my goal would be to especially target these groups. The other questions are ask general questions for me to take a snapshot of their fitness, eating habits, and working status. I also asked under health-related questions if they had any close relatives diagnosed with diabetes because genes are also an indicator of susceptibility. My strategy involves implementing a diabetes prevention and management program which will stress group participation, promote ambience of friendship and teamwork, and integrate an educational platform to address diabetes. I will also encourage managers to increase employee participation as they will be a heavy determinant of the success of a workplace health promotion program. My strategy will also include offering free health screenings, private health consultations, and health assessment workshops. Free Healthy Life cookbooks will also be given out to employees as part of my strategy. My strategy will be driven by incentives. It will involve offering desirable prizes to both managers and Panda Express employees to demonstrate the best positive change in health. We would select 10 to 30 winning restaurants as it would involve all Panda Express restaurants competing against one another. The managers of the winning restaurants will receive a company bonus and a gift, and employees from the winning restaurant would receive cash prizes like gift cards, or resort stays, as well as a highlight in the corporate website. The criteria for a winning team will be based on weight, BMI, blood pressure, and pulse, and blood glucose change of participating employees. Program evaluations are extremely important as we will rely on annual health checkups and thorough records for each employee. BMI, weight, blood glucose, and blood pressure or pulse will be measured. The program will also be implemented yearly or tri-yearly, so we would need an employee data pool of health statistics. I expect improved health from employees both clinically diagnosed with diabetes and those without it. Essentially, the goal is to improve lifestyle and promote healthy living. I would expect employees to lead healthier lives and experience weight loss, greater life satisfaction, and lowered stress. I would also want to conduct an end-of-study survey to pinpoint the strengths and weaknesses of my workplace health promotion program. After doing this, I would present the statistical data gathered to the Human Resources Department. After careful review and evaluation, I would then work with a team to improve and expand upon the model. It is of my opinion that Panda Express is very capable of successfully implementing a diabetes prevention program. Based on my research, Panda Express has made efforts in the past to make employee life enjoyable. Employees have also given high ratings to Panda Express on the following criteria: management, compensation/benefits, job security, job culture, and work. This is good. The CEO, Andrew Churn, has also expressed high interest in the well-being of employees by funding a self-development program to empower managers and leaders. Panda Express has also adopted a strong community presence by being active in charities and sponsoring community projects. This can be seen through their Panda Cares program, which is active in local communities. All of these factors make implementing workplace health promotion programs more likely at Panda Express. Before concluding, I have a few recommendations to the company. While focusing on diabetes, also be attentive of other risk behaviors experienced by employees. Acknowledge the need for outreach toward musculoskeletal diseases, and cancer, for example. I would also recommend looking past the price of workplace health promotion programs, because doing so might result in a greater return of investment. Finally, always remember that improving employee health factors not only into company productivity, but creates a ripple effect into society. Improving health for today's citizens means bettering the health of future generations. Society benefits, and that is perhaps the most important effect of all. Thank you.